Do you suffer from pain in the front of the hip when you cross your legs, get up from standing, or try to put your shoes on? If so, you may have a labral tear in your hip. Before I go over some exercises, be sure to comment below on if you think you have a hip labral tear. The labrum in the hip is a thick fibrocartilage rim that helps to hold the head of the femur in the pelvis. The number one cause of hip labrum tears are due to cam and pincer lesions, or a combination of the two. These are structural abnormalities of how the femur develops when you're a kid. Pincer lesion happens when there's an abnormal bone growth on the pelvis. A cam lesion would be when there's an abnormal bone growth on the femur, and then like I said, you can have a combination of the two. And people have these when they're born. They can be symptomatic with any mechanism of injury, or especially when arthritis is being introduced into the joint space with aging. A glute bridge is a great way to stretch the hip joint in a pain-free way, as well as assist with pelvic stability. Another great pelvic stabilizer exercise is banded hip internal rotation. You can do both legs at the same time or one. Make sure your hips stay flat on the table.